Hello, everyone. My name is Ben Greiner. I'm a current internal medicine resident at the University of Texas Medical Branch at Galveston, Texas. And today I'm going to be talking to you about my poster titled Cancer Screenings During the COVID-19 Pandemic, an analysis of public interest trends. So cancer was the second leading cause of mortality in 2019 and has been the second leading cause of mortality for many years leading up to that point. Now, with the 1.7 million new diagnoses annually, you can see that cancer has a great effect on our public health infrastructure and is requiring further efforts to reduce those effects on our public health infrastructure. That said, new evidence is suggesting that the COVID-19 pandemic has impacted mammography usage, and we're hypothesizing that this effect is branching out further from simple mammography usage to colonoscopy usage, HPV screening, and pap smears. To do this, our objective was to analyze how COVID-19 affected public interest in cancer screenings. And now it's important to note that public interest has been identified as a surrogate for cancer screening incidents using Google Trends. And so with that said, we utilized Google Trends to assess the search queries colonoscopy, mammogram, HPV, and pap smear from September 6th, 2015 to August 30th, 2020, selecting a 5-year period that would best estimate fluctuations that occur each year. Now, Google Trends calculates a relative search interest from 0 to 100, with 100 representing the peak level of interest in that search query. And to calculate what would have happened had the COVID-19 pandemic not occurred, we used a forecasting predictive model called autoregressive interactive moving average algorithms, ARIMA in short, using the program R. What our results ended up showing was that following the onset of the COVID-19 pandemic, there was a sharp decline in all 4 of those search queries, colonoscopy, mammogram, HPV, and pap smear, followed by a slow uptrend back up to baseline. That downtrend started as soon as the COVID-19 pandemic started in early March and then was near baseline in May. Specifically, we saw that interest in HPV decreased by 40% below the expected value. Colonoscopy was 64% below expected, and mammogram was 59% below expected. And lastly, pap smear was 43% below the expected value. What this ultimately means is that there's a great influx of patients that are needing care and that will need to be screened for cancer because they've missed their diagnosis and they've missed their screening windows. What we ultimately recommend is that physicians in both the primary care and oncology settings seek out these high-risk patients and offer them out-of-hospital options for this cancer screening, such as FIT testing, telemammography, and then lastly, preferentially seeking out high-risk cervical cancer patients to perform pap smears and HPV co-testing on them. As you can see, these are my references, and thank you for listening to my presentation.